Hey guys, this is going to be a very brief audio review over just a couple of the tests in Chapter 10 that are very important but kind of difficult to grasp. So it's very brief, it'll be worth your time to watch it, and let's get started. The first test we're going to talk about is a non-stress test. I want you to think of it as we're not stressing the baby out at all because we're not making mom have contractions. So the non-stress test, it is the most widely test used to evaluate the fetus. Its basis is that the fetus produces a characteristic heart rate pattern in response to movement or contractions. So simply put, a term fetus will have accelerations associated with fetal movement more than 85% of the time. So things we have to watch for would be an absent fetal heart rate. ACELs say they're not having accelerations. We have to think maybe they're sleeping, mom is taking a depressant med, or chronic smoking. So if mom's smoking, it can reduce fetal movement. Like I said, it's non-invasive. There are no non-contraindications to it, and it's very simple for mom to understand as well. The process is that we're going to put them on a fetal monitor. We're going to put both of the straps on for the baby to measure their heart rate and for mom as well. We may or may not want to hand mom a button to push with fetal movement because, like we said, 85% of the time fetal movement produces ACELs, so we don't necessarily have to give them the button to indicate fetal movement. If it's kind of not moving around much, sometimes we want to just to say, is the baby moving? And then we can see the little marks right here. You can see these marks. That's fetal movement, and mom has pressed a button. Okay, so here's what we want. We want to, after we've gotten our baseline, we're going to be talking to her, get a good 10-minute strip, and then we're going to want to start recording, and we're going to start watching. We want to have at least 2 accelerations in a 20-minute period. But remember, an acceleration can't be just this right here. It has to be 15 beats up, and it has to last 15 beats over to be considered a reactive. So a 15 by 15 acceleration. If they're before 32 weeks, it's a 10 by 10. So this is a reactive non-stress test, and that is what we want. This test is done with high-risk pregnancies to determine fetal well-being, and this tells us that this baby is good right now. Now this is another non-stress test. What do we see here? We have, we don't really know about fetal movement because there's not any kind of tabs here, but we're assuming that this went on for 10 minutes and there's absolutely no accelerations. There's no 15 by 15 accelerations anywhere on this strip. So we're going to say this is a non-reactive, non-stress test. Again, chronic smoking can influence this fetal activity. With this particular test, because there's not 2 qualifying ACELs in this 20-minute period, we are going to let the physician know, the care provider, and most likely a BPP would be recommended for this particular mom. All right, let's say that we have a non-stress test that was non-reactive, and the doctor's like, well, we really need to do further testing. We do a BPP. Now we may want to do a contraction stress test. This is going to identify those infants that are stable at rest, but when we compromise them, put them under stress, they have decelerations. With this particular test, there are contraindications for it because if we make mom have contractions, we may not be able to stop those contractions. So if we are premature, we have an incompetent cervix, we have a classical C-section scar, there are reasons that we would not do this test. The premise for this test is that a healthy fetal placental unit will not produce late decels even with a contraction. So our goal is to make them have 3 contractions lasting 40 to 60 seconds within a 10-minute period. A negative CST is associated with good fetal outcomes. It means the likelihood of fetal death within 1 week of a negative contraction stress test is less than 1 in 1,000. So this is a negative test, which is a good thing. Now this is the opposite. This is a positive contraction stress test. This is when late decels occur with 50% or more of the contractions. This is not a good result. This will result in hospitalization, further eval, or even delivery of the baby. You'll see there is a late decel associated with at least half of the contractions, even if there are less than 3 contractions. So if you have a contraction stress test and you have late decelerations, there's always going to be further evaluation. A positive contraction stress test usually results in intrauterine fetal death, IUGR, and of course further hospitalization. All right, the last test I want to go over is the biophysical profile, BPP. It's because it sounds confusing, but it's really not. I want to explain to you that it simply is two different things, two different tests. So we do a live sonogram that's going to measure amniotic fluid volume, fetal breathing movements, and fetal movements. And along with it, you're going to have the results of a non-stress test. And this is the picture of the same one. It's a reactive non-stress test, and that's a good thing. It's reactive with fetal movement. So the purpose of the BPP is to determine placental functioning and fetal central nervous system status. It can predict fetal well-being, and the key is to determine the risk for chronic asphyxia. That's important. A result of 8 to 10 is normal if we have enough amniotic fluid volume. This is the test that we're going to do, or that the physician is going to recommend if our non-stress test by itself, say we just have a non-stress test and it's abnormal, they're going to refer that we do a BPP. Is this invasive? No, not at all. You've got a sonogram and a non-stress test. Very uninvasive, has some good information in it.